Hello everyone, my name is Dr. Dar. I'm one of the GPs based in England. Today we will be talking about a really interesting and common topic, how uncontrolled blood sugar in diabetes affects the small blood vessels throughout the body. And we will also explore what happens when these tiny blood vessels are damaged, the complications that follow, and most importantly, how we can prevent them. So stay tuned. So, what is microvascular disease? Microvascular disease is a condition where the tiny blood vessels in the body they become damaged due to long-term high blood sugar levels, and it commonly affects the areas like eyes, where the damaged blood vessels can lead to blurry vision or even vision loss. Yes, you heard it right, even it can cause the vision loss. It can also affect the kidneys, where these leaky blood vessels they can cause proteins, or the level of proteins in the urine it go high, and over the time it leads to kidney failure. Then the most common one is like it can affect the nerves as well throughout the body, and which can cause numbness, tingling, or burning sensation, especially in the hands and feet. This often progresses silently. So the microvascular disease in diabetes, it's not like a something that happens overnight or over days. It progresses very silently. So this is just, we talked about the complication areas, which you can see is the eye, where it can cause the retinopathy is a medical term, which basically means it affects the vision. Then you can see this is kidney in the center, and it can affect the kidney function, which we call nephropathy. And then also when it affects the nerves, then it can cause the, which we call neuropathy. It can affect the numbness, tingling, and the pain, which is very common at night. And most of the diabetic patients, when they come to me, they often tell me that at night they can't sleep because of the burning sensation or the heat sensation from the feet or from the hands. So this, you can see the complications of diabetes, and these are the major organs that are affected. When we talk about the microvascular, then it means basically it's affecting your nerves, and it affecting your kidneys, and also it affecting your eyes. However, in a broader term, it can also affect the major or the big blood vessels in the brain, causing a stroke, or the major blood vessels in the heart, causing a heart attack. So this goes beyond basically, although the microvascular damage involves the smallest blood vessels, but as I mentioned, it can lead to the serious health issues as well. And the researchers have shown that people with the diabetes who develop complications like eye problems, kidney damage, or nerve pain, they have a greater chance of also experiencing heart attack or stroke. So the more of these small vessels complications someone has, the higher the risk becomes. And these issues are not isolated. They may actually signal that your heart and brain health are also under the threat. Let's talk about how this damage happens, why the tiny blood vessels in our body they become faulty. So basically what happens, like when someone has a high blood sugar for a long time, like in diabetes, it can slowly hurt the tiny blood vessels in the body. And these small blood vessels are like tubes that carry blood to the important places like eyes, kidneys, nerve, brain, heart. And then over the time, high sugar makes the wall of these tubes thick, furry, and they become weak, and they might start to leak, or they may even get clogged, which basically means less blood and oxygen reach the organs. And as a result, the eyes might have trouble seeing, your kidneys might not clean your blood properly, and your nerves, especially your hands and the feet, they can start to hurt, tingle, or feel numb. So this is how the damage happens. As you can clearly see in this picture, what usually happens: high blood sugar causes thickening and leakiness, then it causes reduced oxygen delivery to the tissues. Obviously, it incites some inflammation, and then causing a damage and the less blood supply to the target organs, and then all those complications. It's basically just the repetition of what we have just discussed about broader health impact, like how this condition can not only affect the small blood vessels but also the big blood vessels in the body, leading a heart attack or the stroke. And then obviously more you have a microvascular issues, the greater the chances that you would get the heart issues. So higher, significantly higher risk, and this is proved by different studies. So here is a good news that all these issues or complications, they are preventable, and there are a few steps you can do to protect your small blood vessels and slow down any damage. What you can do is, like, you can control your blood sugar levels. If you keep your levels steady, it can reduce the harm to your blood vessels. Then also you can just watch out your blood pressure and cholesterol levels, because high levels can put added pressure on these tiny blood vessels. You can get your blood sugar levels checked regularly, or you can book an appointment with your GP to get a blood test done, and they can check your blood sugar levels in the over the last 3 months, which we normally use in the general practice in England. You should also be on top of your screening programs like yearly eye exams, kidney tests, and foot checks, so that if there's any problem, it can be caught early. Then you should aim to live a healthy lifestyle. You should be physically active, eat balanced diet, avoid smoking, and then follow your prescribed treatments, whatever the healthcare professional has um, issued you or prescribe you the treatment. You should be following it. There should be a good compliance, and you should work with your healthcare team closely if you are really worried or you're concerned about anything, about the risks or about anything. You should consider speaking to them and see what you can do to prevent the future complications. So here is a take-home message. In summary, diabetes can slowly damage the tiny blood vessels in important areas like eyes, kidneys, and nerves. But with regular checkups, good blood sugar control, and healthy daily habits, you can reduce the risk of serious complications. And also speak with your healthcare provider to find the best plan for you that works for you. But remember, all these complications are preventable and manageable, and but you should try to stay informed and work with your healthcare team so that they can offer you the best management pathway for your diabetes. And that's it for today. Thank you so much for watching this video. If you have any question, please feel free to drop a message in the comment section, and I will try my best to get in touch with you as soon as possible. Thank you. Bye.